Goats are intelligent and versatile animals that bring joy and utility to farms worldwide. Whether you're raising goats for milk, meat, fiber, or companionship, their health and well-being are essential for a thriving herd. Maintaining good goat health requires proactive care, an understanding of common health issues, and effective disease prevention strategies. In this guide, we'll cover vital health tips, vaccinations, common illnesses, parasite management, and overall wellness practices to help your goats live long and productive lives. 1. The importance of goat health. Healthy goats are happy and productive goats. Keeping your herd in good condition not only enhances their quality of life, but also maximizes their contributions to your farm. Good health ensures better milk production, higher quality meat, healthier kids, and softer fiber. Regular attention to your goats' needs will help prevent issues before they arise. 2. Basic health management tips. Here are foundational steps every goat owner should follow to maintain a healthy herd. Daily observation. Spend time with your goats every day to observe their behavior, appetite, and physical condition. Early signs of illness often include lethargy, loss of appetite, limping, or changes in stool consistency. Clean environment. Ensure your goats live in a clean, dry, and well-ventilated area. Proper hygiene reduces the risk of infections and respiratory issues. Fresh water. Always provide clean and fresh water. Dehydration can lead to a host of health problems. Proper nutrition. Feed your goats a balanced diet tailored to their age, purpose, milk, meat or fiber, and reproductive status. High-quality forage, grains, and mineral supplements are essential. Hoof care. Regularly trim your goats' hooves to prevent overgrowth, which can lead to lameness or infections such as foot rot. Vaccinations for goats' vaccines are critical for protecting your goats against infectious diseases. Here are the most common vaccinations recommended for goats. 3.1. CDT vaccine. The CDT vaccine protects goats against 3 deadly diseases: Clostridium perfringens type C and D. These bacteria cause enterotoxemia, also known as overeating disease. Tetanus. Caused by Clostridium tetani, tetanus is a life-threatening condition. Vaccination schedule. Kids. First dose at 4 to 8 weeks old, followed by a booster 3 to 4 weeks later. Adults. Annual booster shots. 3.2. Additional vaccines. Depending on your region and herd's risk factors, your veterinarian may recommend additional vaccines such as caseous lymphadenitis, rabies, if required by local regulations, pneumonia prevention vaccines. Always consult with your vet to develop a tailored vaccination program for your herd. 4. Common goat illnesses and how to address them. Understanding common health issues can help you recognize symptoms early and seek treatment promptly. Below are some frequent goat illnesses and how to manage them. 4.1. Mastitis. Mastitis is an infection of the udder, often seen in lactating does. Symptoms: swollen, hot, or hard udder, decreased milk production, abnormal milk, clumpy, watery, or bloody. Treatment: consult a vet for antibiotics. Maintain udder hygiene and ensure proper milking techniques. 4.2. Pneumonia. Pneumonia can be life-threatening, especially in young or stressed goats. Symptoms: difficulty breathing, coughing or nasal discharge, lethargy and fever. Prevention and treatment: provide shelter from extreme weather. Keep housing well ventilated. Administer antibiotics as prescribed by a vet. 4.3. Scours, diarrhea. Scours is a common issue in kids and can lead to dehydration. Causes: dietary changes, parasites, bacterial or viral infections. Treatment: rehydrate with electrolytes. Identify and address the underlying cause. Keep the affected goat isolated to prevent the spread of disease. 4.4. Pink eye. Pink eye is an infectious eye condition that spreads quickly in herds. Symptoms: red, swollen eyes, watery discharge, sensitivity to light. Treatment: isolate affected goats. Apply antibiotic ointments or drops as prescribed. Keep pens free from dust and debris. Fifth, parasite management. Parasites are one of the most significant health threats to goats. Internal and external parasites can lead to weight loss, anemia, and even death if not managed properly. 5.1. Internal parasites. Common internal parasites include roundworms, coccidia, and liver flukes. Symptoms: weight loss, diarrhea, pale gums, anemia, poor coat condition. Prevention and treatment: conduct regular fecal tests to monitor parasite loads. Rotate pastures to prevent overgrazing and parasite buildup. Use dewormers as needed, but avoid overuse to prevent resistance. 5.2. External parasites. External parasites like lice, mites, and ticks cause itching, hair loss, and skin infections. Prevention and treatment: regularly inspect goats for signs of infestation. Use appropriate topical treatments or sprays. Maintain clean bedding and pens. 6. Overall wellness tips. A comprehensive wellness program is essential for keeping your goats healthy and thriving. Here are some additional tips. 6.1. Regular health checks. Perform routine health checks to monitor body condition score, ideal weight and muscle tone, coat and skin health, eyes, ears and nose for discharge or abnormalities, hooves for signs of overgrowth or infection. 6.2. Biosecurity measures. Preventing the introduction of diseases to your herd is critical. Implement these biosecurity practices. Quarantine new goats for at least 30 days before introducing them to your herd. Avoid sharing equipment with other farms. Limit visitors to your goat pens. 6.3. Breeding and kidding care. Proper care during breeding and kidding ensures healthy kids and does. Provide adequate nutrition during pregnancy and lactation. Monitor does closely during kidding and assist if complications arise. Ensure newborn kids receive colostrum within the first 24 hours. 6.4. Stress management. Minimize stress in your herd to boost immunity and prevent illnesses. Stress factors include overcrowding, sudden dietary changes, extreme weather. Ensure goats have plenty of space, consistent routines, and shelter from harsh conditions. 7. When to call a veterinarian. While many health issues can be managed at home, some situations require professional veterinary care. Contact your vet if a goat shows no improvement after home treatment, symptoms worsen or become severe, e.g., high fever, labored breathing. You suspect a contagious disease in your herd. You're unsure about vaccination or medication protocols. Building a relationship with a trusted veterinarian will make it easier to address health concerns promptly and effectively. Caring for goats involves proactive health management, disease prevention, and prompt attention to any signs of illness. By following these health tips and addressing common issues, you can ensure your goats lead healthy, happy lives while maximizing their contributions to your farm. Whether you're a new goat owner or an experienced farmer, investing in your goats' well-being is key to a thriving herd.